here's the current software that we're using. I highlighted the top 3 because these are the ones that we're most commonly using. And then I probably should have switched these 2 here, because really what I want you to leave here today is understanding how do I get in and use Blue Sky Plan, and how do I use Rayware to actually print what I'm creating in my office. So these 2 are really the bread and butter of this whole thing. This is our design software. This is our output software. So this is how we actually print out of the Sprint Ray. Mesh Mixer probably should have been 3rd, but Mesh Mixer is kind of that handy tool in your pocket when you get a file, and we're going to talk about file types. When you get a file that's just kind of, it's not working how you want it to work. It's corrupted, or there's a hole, there's a defect in it, and you can't understand why. It's kind of like the Windows Paint tool, where you can go and just make some edits to your 3-dimensional file. Mesh Mixer is kind of the go-to for us and for a lot of guys in the digital world. So it's a little bit more complex, but once you start understanding the basics, it allows you to do some really, really cool things to your files and kind of and add improvements to that. So Bellis, this is face scanning. Exocad, this is more of our lab stuff. So I know you guys, well familiar with Exocad 3Shape. This is a lot of times what the labs use. D3 Tool, this is a cool program for designing splints. DTS Pro, cool software for simulations, smile designs, if you want to simulate and show the patient various things. And then everyone's probably, well, I don't know how many people have a CBCT in their office. A lot of you guys. Okay, cool. I mean, in order to do surgical guides, you got to have a CBCT. So that's a big piece of this equation, is like without a scanner and without a CBCT, it's really difficult to do this. Farming out for CBCTs is going to add complexity to that. So whatever your CBCT is of choice, you're going to have your viewer application. With Blue Sky Plan, these are called modules. And so we're going to use the term module a lot. Are you in the right module? These are the 6 modules that Blue Sky has. And the one on top is really where we are today. So surgical guides, that's where we're going to be focusing on. We want you guys designing a surgical guide. But I'll touch on, and this is a free software with paid exports. So the software is free to download, it's free to use, it's free to create things. But to actually pull a surgical guide out that you've created, it costs about $20, $15 to $20, depending on the volume. And so that's your digital overhead to design a surgical guide in the design process.